this event. Is it working? Great. I want to thank Senator Menendez for coming today, but most importantly, I also want to thank all of the heroes that stand behind me and family members of heroes have weathered the worst of this crisis since the beginning. And I want to just center us today on them, because that's why we're here. That's why the senator is introducing his legislation. And that's why I come to work and my management team comes to work every single day, to make sure that the frontline heroes are equipped with everything they need to meet the healthcare needs of the day. And that couldn't have been more pressing and difficult during the course of this pandemic. And that's what we're going to be discussing today. Senator, the last time you hosted a press event here was February 9th of 2020. And I remember it very well because in many ways, it was the last day that things felt normal for today. And you said then that we as a country were not taking the right steps as a nation to address what was then an emerging health crisis in China. And sadly, none of us ultimately knew how right you were. The truth is that the federal government was not prepared to assist hospitals or states to fight COVID-19 during its devastating first wave here. At peak, we had over 300 patients here at University Hospital, all being treated for COVID-19, many of whom were members of Black and brown communities. We also have with us Secretary Jay Johnson today, and I want to thank him for his incredible work throughout the Obama administration, but also since then in advocating for communities of color and for justice. All of this was never more pressing, again, than during the course of the pandemic, when we found that the inequities in healthcare and health outcomes in Black and brown communities were much worse than the general population. And what we found is that COVID-19 shone a light on these pressing disparities in ways that we never had before. Almost every person in our rooms, when we had over 300 patients, was a person from a Black or brown community. A Black or brown person was affected by this. And normally we treat a very diverse community, but we never saw the extent of the health inequities in the community more than we did then. Recently, I testified to the Senate Committee on Homeland Security and Government Affairs about University Hospital's experience during the COVID-19 pandemic. For decades, our nation has struggled to appropriately focus on the strategic national stockpile of essential supplies and medication. And while it was tempting to point fingers at this administration or that, the fact of the matter is that the failure to maintain the country's strategic stockpile was a long-term oversight that spanned many decades. And so we are littered with a lot of systemic failures that we absolutely need a strong investigation to uncover. I said a few short weeks ago in Washington, and I'll say it again, despite the incredible efforts of the Biden administration and our state government here in New Jersey under Governor Murphy's leadership, I am not convinced that we are yet prepared for the next pandemic, whether it is a vaccine-resistant variant of COVID-19 or a different pathogen altogether. There is still much work to do, but I do believe this commission will help us get there. Taking the time to intentionally investigate the nation's pandemic response and make recommendations about the changes we need from the ground up and that we all need to make as healthcare providers, as local governments, and as the federal government, this will save lives in the future. And I believe we have the perspective here at University Hospital to confirm that. And so at this time, it is my distinct honor to introduce United States Senator Menendez, who will tell us more about his vision for this commission. Senator?
Thank you, Doctor, very much. Well, thank you, Dr. Elnahal, very much for hosting us once again at University Hospital. I appreciate your leadership. I appreciate the ability to call on you when we are thinking about different healthcare challenges and the insights you provide. So thank you enormously. And at the same time, I'd like everyone to join me in giving a round of applause to all the frontline healthcare workers here with us today. We cannot thank you enough for the sacrifices you've made throughout the pandemic, and we will never forget it. Thank you very, very, very much. Let me also thank former Secretary of Homeland Security Jay Johnson for being here. I am fortunate to have a constituent with your experience at this critical moment in our history. I appreciate Debbie White, the HPAE president, being here, and the other members of her union. They are frontline. They represent the frontline workers every day. I also want to thank Sabila Khan and all of the grassroots COVID advocates here today. Sabila's father, Mr. Shafkut Khan, died of COVID-19 last year after contracting the virus in a rehab facility. I knew Mr. Khan well. He was a leader in Jersey City's Pakistani community, always standing up for the rights of others, and especially immigrants. He was a kind and fundamentally decent man. And Sabila, and to your mother, I also know he would be proud of you and your activism in the wake of his passing. And before we continue, I'd just like to observe a moment of silence for the families who are here with us today who lost a loved one, and for so many more who lost a loved one. Thank you. And before I continue, I want to say I've been praying for the full recovery of former Pennsylvania Governor and our first ever Secretary of Homeland Security, Tom Ridge. Throughout this crisis, Secretary Ridge has been deeply engaged in the issues related to pandemic preparedness, and I hope we'll keep him and his family in our thoughts. He was supportive. He has been supportive of this legislation as well. This morning, I want to start off with a simple question. Will we as a country emerge from this pandemic safer and be more prepared than how we entered it? I believe the answer lies in whether or not Congress establishes an independent commission focused on our pandemic response, as I propose in the bipartisan, bicameral National Coronavirus Commission Act. Co-leading this effort with me in the Senate is my Republican colleague, Susan Collins of Maine, and in the House of Representatives, Congressman Tom Malinowski, a fellow Democrat from New Jersey, along with Florida Republican Congressman Mario Diaz-Balart, who have introduced the companion bill. I first proposed this legislation back in September of 2020, when COVID-19 had claimed the lives of nearly 200,000 Americans. At the time, the death toll seemed unthinkable. Little did we know how much more tragedy was headed our way. 200,000 would soon become 300,000, then 400,000, then 500,000. And today, we come together on the heels of another grim milestone, 600,000 lives lost to COVID-19 nationwide. It's hard to wrap your mind around those numbers. But we have to remember that each of them, number 500,001, number 500,002, were real people with real friends and family who loved them. 600,000 mothers and fathers, sons and daughters, brothers and sisters, grandmothers and grandfathers, friends and neighbors, all of them gone forever. I don't care where you stand politically, it did not have to be this way. How could such a staggering loss of life happen here in the most powerful nation on earth? And what can we do to make sure that America is never again caught flat-footed when faced with a deadly and contagious virus? We owe it to the families of the 600,000 people lost to COVID-19 to get answers, just as we did to the families of the nearly 3,000 Americans who perished on September 11th of 2001. That's why Congress formed the independent 9/11 Commission to investigate the security missteps that left us vulnerable to terrorism and to create recommendations for preventing future attacks on American soil. I voted for the 9/11 Commission when I was in the House of Representatives, and then I led the fight to implement its recommendations from strengthening emergency preparedness to shoring up port security to improving our intelligence sharing. It should be a national outrage that COVID-19 has claimed more than 200 times the number of lives lost on September 11th. And Congress has yet to establish a similar independent, nonpartisan commission to investigate what went wrong and how we can be more prepared for the next pandemic. And inevitably, there will be one. What were the vulnerabilities in our supply chains that sent states into bidding wars against each other over personal protective gear? How can we ensure that U.S. officials can get on the ground quickly wherever the next outbreak takes place before it reaches our shores? How can we lessen the economic fallout from future pandemics? How can we improve our public health infrastructure to better protect low-income minority communities and the most vulnerable? These questions are just the tip of the iceberg. There are many more, and they all deserve answers. Now, some suggest that we don't need a 9/11-style commission on COVID because there are already private efforts in the works. To them, I say this: private-led efforts are worthwhile, and they are commendable. However, outside groups will never have the resources made available to a congressionally sponsored blue ribbon commission with full subpoena power and the ability to compel witnesses to testify. Nor will outside recommendations be guaranteed any consideration by Congress. Others in Washington have claimed this commission is about scoring political points or digging up dirt on the past administration. I say to them, in fact, this commission will span both the Trump and Biden administrations and any before them if the failures that are detected go back further in time. And I'm willing to bet that not a single one of them could look a survivor in the eye and say that with a straight face. I dare them to look into the eyes of any American in mourning and tell them, sorry, this is just a pandemic response goes in the most powerful nation on earth. The truth is, my legislation insulates the commission from political interference and puts fact-finding first. It will be nonpartisan, with an equal number of commissioners appointed by Republicans and Democrats. We have strong supporters from leaders in both parties, like President Bush's DHS Secretary Michael Chertoff, Ben Bernanke, the Federal Reserve Chair under both Presidents Bush and Obama. This is not about pointing fingers. It is about identifying what went right, what went wrong, learning from our mistakes, and making sure that we do not repeat them again. So I have a simple message for the politicians and the pundits hemming and hawing over this proposal. The National Coronavirus Commission is not for you. It is for them, for the 600,000 Americans lost to COVID-19 and all those who lost a loved one. It is for the countless others who survived the virus but continue to deal with long-term health complications. It is for the doctors who scramble to save the lives of patients succumbing to an unknown disease, and the nurses who day after day after day held the hands of patients as they took their final breath. This commission is not for Republicans. It is not for Democrats. It is for the American people. Many of the survivors here with us today lost someone they dearly loved to COVID-19. Others fought their own battles against this virus. For them, our country may be reopening, but their lives will never, quote unquote, go back to normal. So to all of the survivors of this pandemic who feel as though they are invincible, I have a message for you. I see you, I hear you, I won't forget you, and I'm going to continue to fight for you. Never again must the United States be caught up with its guard down in the face of a deadly and contagious virus. Now, let me just say a few words in Spanish, and then I will turn it over to Secretary Jay Johnson. Estamos aquí hoy para cumplir con las vidas de los 600,000 personas, ciudadanos americanos que murieron al COVID-19 y a sus familias que lo sobreviven. Tenemos que tener una comisión independiente similar a la de septiembre 11, donde perdimos 3.000 personas. Y pensábamos en ese momento, qué tragedia, 3.000 personas. Estamos hablando de 600.000 personas. ¿Cómo es que en el país más poderoso, más rico en el mundo, actualmente, no estábamos preparados? ¿Y cómo es que vamos a asegurar que para el futuro vamos a estar preparados contra cualquier pandemia que pudiera realizarse? Y vimos las consecuencias no solamente en la pérdida de vidas, en las enfermedades que personas todavía tienen, que contrataron el COVID-19, la falta de nuestros hospitales, la falta de las necesidades para nuestras enfermeras, doctores, en fin. Tenemos que tener una comisión independiente que puede estudiar toda la historia, desde la otra administración, de esta administración, de cualquier otra administración que quizá falló en no estar preparado para el futuro, para que nunca los encontramos en esta situación. Y estoy contento de que esta propuesta es bipartidista, bicameral. La senadora Susan Collins, republicana de Maine, que está coauspiciando esta ley conmigo. Los congresistas en la Cámara, Mario Díaz-Balart, y también nuestro colega de New Jersey, Tom Malinowski, actualmente están auspiciando la misma ley. Así que bipartidaria, bicameral, y la condición y comisión está estructurada de una forma completamente bipartidista. Merecemos y debemos este compromiso con todos esos que perdieron su familia y que actualmente todas esas vidas que se perdieron también. With that, let me call former Secretary of Homeland Security, did an exceptional job in defending our country in so many different dimensions. And we are fortunate to have him as a New Jersey and to be able to call upon his expertise, former Secretary Jay Johnson.
Thank you very much, Senator Menendez. When I was Secretary of Homeland Security, I had a lot of exposure to Congress, sometimes more than I wanted. But I know Bob Menendez is one of the smartest, most capable members of the United States Senate. As I've said many times, I am proud and pleased, Senator Menendez, that you represent the state of New Jersey in the United States Senate. COVID-19 is a lethal pandemic that touched every corner of this state and this nation. It took hundreds of thousands of American lives, wrecked our economy, pushed our public health care apparatus to the brink, and knocked our society and our world off its axis, perhaps permanently. In this country, we recall the alarm we all felt last year at the early prediction that COVID would take the lives of up to 230,000 Americans. Today, the death toll stands at just over 600,000. We should never become numb to that number. It is greater than the American military death toll from World War I, World War II, and the Vietnam War put together. It didn't have to be this way. The men and women represented here today in this building responded heroically. But as a nation, we could have done better. Now we must learn from this horrible experience. I endorse the National Coronavirus Commission Act of 2021, and I thank Bob Menendez and Senator Susan Collins for their bipartisan sponsorship of this bill in the Senate. I have read the bill. I can't say that about every bill, but I have read the bill. It calls for a bipartisan commission of 10 distinguished Americans, 5 Democrats, 5 Republicans, with subpoena power to conduct a comprehensive review of COVID-19, its origins, our preparedness, and our response, and will put forth recommendations for the future. It is critical that we do this. There should be no doubt that we do this. COVID-19 was not the first, and it won't be the last pandemic to reach American shores. Those who do not learn from the mistakes of history are bound to repeat them. Thank you, and thank you for sponsoring this legislation.
Well, thank you, Mr. Secretary, very much. And now Sabila Khan of Jersey City, who lost her beloved father and represents many of the families who lost a loved one. Sabila?
Oh, sorry. My name is Sabila Khan, and I am one of the millions of Americans who have lost a loved one to COVID. My father, Shafqat Khan, was the loving father of 3, the doting grandfather of 7, and the devoted husband to my mother for what would have been 50 years last October. As a community activist in Jersey City, he spent years carving out spaces and opportunities for others. He was a good human being and who devoted himself to his family and his community. On March 11th, as the tri-state area went into lockdown, the rehab facility where my father was receiving physical therapy for Parkinson's closed its doors to visitors. We never saw him again. After a week of growing increasingly alarmed when he stopped answering his phone, we were told that my father was congested, had lost his appetite and his ability to speak, and had a low-grade fever. He was rushed to a hospital 3 blocks away from us, where he spent 3 days in a war zone of an ER waiting for a hospital bed. He died alone, without his family by his side, 4 days later, on Tuesday, April 14th. It truly takes my breath away to imagine the fear, isolation, and trauma that my father suffered during the last week of his life. It's something that will haunt me for the rest of mine. My father was buried the following day, and in what was the most surreal and heartbreaking moment of my life, I had to watch his burial live streamed on my phone. But sadly, my story is not unique. When my father died last April, the COVID death toll in the US was 26,000. 14 months later, we've added almost 575,000 more American lives to the tally. Something went terribly wrong here, and we, the COVID bereaved, are demanding answers. Let's not forget, people are still dying. Last week, we surpassed 600,000 deaths. For every COVID death, there are an estimated 9 close family members left behind. That's an estimated 5.4 million Americans left with PTSD, feelings of guilt and anxiety, lack of closure, and the burden of knowing that their loved ones died traumatized, isolated, and alone. No family deserves this. Mine certainly didn't, and neither did the millions that came after us. In trying to navigate my own trauma, I took the lessons I learned from my community activist father, and 4 days after he died, I started COVID-19 loss support for family and friends, the first Facebook bereavement group for people dealing with COVID loss. We're now the largest support group in the country, with more than 10,000 members from all 50 states who have lost parents and grandparents, spouses and children, siblings and aunts and uncles. A shocking number have lost more than one loved one to this virus. We come from diverse backgrounds and political affiliations. In fact, I'm proud to share that our group includes members who voted for Biden, as well as those who voted for Trump. And in spite of our differences, most of us would agree on the fact that a COVID commission is urgently needed. Today, we thank Senators Menendez and Collins for their leadership in bringing forth the bill for a COVID commission. We believe that a nonpartisan, independent, equitable, fully funded, comprehensive, and fair COVID commission must center the voices, experiences, and needs of the communities most gravely impacted by this virus. Not only the bereaved, but also frontline healthcare workers and COVID long haulers. We must take a full and unvarnished look at what happened and why, so that we can understand how to make sure it never happens again. We demand support from both sides of the aisle for this, because if COVID has shown us anything, it's that viruses don't discriminate across party lines. And in order to properly safeguard Americans from a future pandemic, we need to start doing the same. We expect the findings to set into motion legislation and best practices that will save lives and spare others the trauma that millions of us are suffering today. And I want to add that while none of the findings will change the fact of how our loved ones died, a COVID commission can bring so many families some measure of closure and healing. As the nation races towards reopening and normalcy, it's hard not to feel like our loved ones are being pushed aside as inconvenient statistics. But the conversations we are starting to have around the need for a COVID commission are giving me hope. Hope that the suffering and untimely deaths of 600,000 Americans will not be forgotten, and hope that we will be able to take the difficult lessons learned during this season of unprecedented grief and apply them towards building a safer and more equitable nation for all. Thank you.
Thank you, Sabila, and thank you for sharing your personal tragedy and all of the sentiments that flow with that. And finally, Dr. Karma B. Warren, who is an emergency physician here, an adjunct professor as well, and has been at the front lines of seeing this challenge and how it affects real-life people. Dr. Warren?
Good morning. Good morning to Senator Menendez and the other elected officials, to a New Jersey Medical School leader, Dean Johnson, in his absence, to University Hospital CEO and President, Dr. El Nahal, and other medical school and hospital officials in attendance, and especially to my colleagues in medicine and public health. I salute you. I salute all your efforts to protect against future health crises. I am Dr. Karma Brown Warren. I'm an associate professor here at New Jersey Medical School, and I'm also an attending physician in the University Hospital in the emergency room. As an emergency physician at this level 1 trauma center, where we take care of some of the sickest patients in New Jersey, I speak on behalf of all of us who worked daily in the trenches, risking our own health and our safety, especially during the pandemic. So when I was asked to speak about my experiences being on the front lines, well, I jumped at the chance. Why? I needed people to understand, especially the non-believers, the doubters, the anti-vaxxers, those who claim, well, it really wasn't that bad, or said, well, I didn't get it. They needed to understand this was real, this was scary, and unfortunately, this was us. Let me take you back to last spring on those days in the emergency room when I was talking to you 1 minute and coding you the next. It was your daughter, your cousin, your grandparent, your son, and they were the ones that we could not save. It was the community of color that made up more than the 40% of the 860,000 infections in New Jersey state alone. What was even scarier is that we as physicians didn't even know the best way to treat the coronavirus, also known as COVID-19. We knew those with COVID morbidities and comorbidities were at greatest risk for severe illness and death, but I couldn't explain that healthy 30-year-old female or male that came in and was just as severely ill. Who was not immune to this? We are in a better place now, so I have to say that. And with the current vaccines, we are continuing the upslope, but we must be vigilant with the fight and prepare for the next one. See, it was during the pandemic that some things went right in some places and terribly wrong in others. The commission that Senator Menendez has introduced will be uniquely positioned to gather all the facts that will examine the challenges and prepare a preparedness strategy that will guide us by the good work and innovations that my colleagues have developed to deal with these unprecedented conditions. Like a strong military does after a war, it has become clear that we have an effective response to this global healthcare emergency. It will require a comprehensive after-action report and briefing so that we, the troops, can learn from one another and support one another and not repeat the same mistakes. In my opinion, there should be no time wasted in strengthening our public health infrastructure by establishing the National Coronavirus Commission Act of 2021. Therefore, I stand in support of and applaud Senator Menendez for this healthcare advantage. And honestly, I don't ever, and I mean ever, want to see another year like 2020 of unpreparedness again. Thank you.
Thank you, Dr. Warren. I think we've heard the personal tragedy, emotional side. We've heard the preparedness side. We've heard the healthcare side. I think we've made a compelling case. With that, I'm happy to take a few questions.
Senator,
Yes.
what is the status of this legislation right now? If you could please update us. It's been introduced, both House and the Senate. Has it gone to committee hearing? What are your hopes for a timeline on this?
It is introduced in both houses. It's pending before the respective committees. We are socializing and building support for it. I've had several colleagues who have signed on and others who are inquiring. I'm particularly pleased to see that I have some very legitimate Republican colleagues that have inquired about it, and I know that Senator Collins and I are both working with them to get them to a yes. The more support we build for it, the better off we believe we can be. We have asked the respective committees for hearings, and we believe that at the end of the day, whether it is a standing piece of legislation that gets a vote, or, as we often do, putting this legislation through in what I call a moving vehicle, some other legislation that has to pass, is an option. And so I am confident this is much different, because people ask me all the time, well, the January 6th Commission didn't get off the ground. This is different. It is not only bipartisan in its appointment process, it spans more than one administration. It specifically has a structure that calls for, among the appointments, one appointment must be a former governor, one appointment must be a healthcare specialist, one appointment must be an economic specialist. So we have spent a lot of time, Senator Collins and I, devising legislation that can appeal to both sides of the aisle. And we think we've hit the sweet spot, and we are building support for it. Yes.
Senator, two questions. One, what is the price tag on this? And two,
I'm sorry, what's the first one?
price tag.
Price tag.
The
Yeah.
second question, based on the current state of politics, how realistic is this to get it passed, and how do you convince resistors?
Okay. We authorized appropriations of up to $50 million. For context, the 9/11 Commission was ultimately appropriated at about $15 million, roughly about $22 million in today's dollar terms. We have a larger authorization because the scope of the crisis and the Commission's mandate is much, much bigger. In terms of getting over the question of partisanship, I highlight all the time to some of my colleagues who have asked me, well, isn't this really about going after former President Trump? I say, no, it is two administrations. You know, I generally think the Biden administration has done a relatively good job of what they inherited, but maybe they haven't done everything they should have done. Maybe they haven't prepared us for the next round. Maybe there is an administration going before the last administration that, looking at Ebola or the HN virus or something like that, should have been laying the foundation for better preparation. So it is a very broad mandate, and I think when we speak in that regards, we get more people to be supportive and less people to think of this in a partisan regard. But as Sabila said, look, I don't think Americans are going to tolerate this being swept under the rug and forget about it and we move on. I just don't think that's going to happen. And so the other thing that we are doing, and we have a wide range of organizations, I'm sure Steve can share with you, national organizations on both sides of the aisle that are supporting the commission, as well as incredible individuals on both sides of the aisle that are supporting the commission. But we also think that the survivors are going to be a compelling movement for the commission. So we think all of that together brings us in a different dynamic.
Senador, quiero que me hable un poco acerca del sentido de urgencia de esta ley. Tengo entendido que, de ser aprobada, tomará 60 días, por lo menos ese tiempo tendrán el Congreso, el presidente, para nombrar esta comisión de 10 miembros. Entonces, dicha comisión tendrá cerca de año y medio para hacer su reporte. Estamos hablando de casi 2 años antes de saber qué pudimos haber hecho mejor, qué cosas podemos corregir. Y actualmente, ¿entiende usted justo decir que miles de personas más morirán en ese periodo de tiempo?
Bueno, reconocemos que la urgencia es necesaria para prevenir cualquier otra pandemia. Ya estamos en el medio de esta pandemia, ¿no? Y quisiéramos tener todas las preguntas ya con contestas para saber. Pero si vamos a hacer un trabajo efectivo, eficaz, actualmente no hace falta el tiempo para estudiar. Por ejemplo, parte de lo que dice la ley es también estudiar dónde es el origen del COVID-19. Eso va a tomar tiempo y facilidades. Traer los mejores pensamientos en el país del sector de salud. De traer los mejores sentidos de cómo es que podemos crear aquí en el país los elementos esenciales de lo que le hace falta en equipo y medicinas sin tener que esperar de que eso se hace en otros países. Como todo eso es el tipo de trabajo que estamos hablando, un trabajo que va a ser bastante arduo y por eso va a tomar tiempo. Entre tanto, mientras que la comisión está estudiando, si decide que hay evidencia de algo muy importante de compartir, no tiene que esperar los 18 meses. Si creen que hay algo que ellos han determinado que pudiera salvar vidas entre medio, bien. Pero si no, le ponemos una finalidad de año y medio. Si ellos cumplen su trabajo antes de año y medio, también se puede reportar. Así que estamos haciendo todo lo posible para ser completo, intensivo, pero a la misma vez efectivo para nunca tener esta situación de nuevo. Any other questions? I'm sorry? No, I can't. No, okay. So the question was, well, you know, with the urgency of the moment, we give 60 days upon its passage for the appointments to be made, and we give the commission up to a year and a half. Why so long? And so the answer is the commission's mandate is incredibly deep and wide. We want to get it right, and we don't want time to abbreviate getting it right. If the commission along the way makes determinations that in fact particularly are compelling and could save lives, they could issue interim recommendations. If they finish before in a year and a half, they can issue their ultimate findings. But because of the nature of what we're looking at, including origins, part of the legislation speaks to determining the origins. It talks about supply chains. It talks about our medical preparation, our public health system. How do we gird against the economic challenges of a pandemic? How do we deal with the interaction of government, federal, state, and local in dealing with a pandemic? How do we deal globally in the dealing of a pandemic? That is an enormous mission. And we don't want to truncate time in order to get answers when time may be what's necessary to get to the depth of everything and get it right. And getting it right, I think, is ultimately most important. Any other questions? If not? Okay. Again, thank you all for coming. Appreciate it.